Thanks very much, Mr. Speaker. I'd first like to associate myself and my colleagues with the Health Secretary's condemnation of the racism sadly faced by members of the England football team after their impressive performance throughout the Euros. Now, turning to COVID, the Secretary of State himself has suggested COVID cases could soar to 100,000 a day once all restrictions are removed next Monday. While research shows hospitalisation rates have thankfully dropped to 3% of cases due to vaccination, this would still mean up to 3,000 admissions, the same as during the first wave. Can he explain how he will avoid such a surge, putting pressure on health services, which would further delay clearance of the backlog of patients waiting with other conditions? With the likelihood of such high transmission rates, how does he hope to prevent the generation of yet more new variants within the UK, perhaps with significant vaccine resistance? Evidence is growing of the debilitating impact of post-COVID morbidity, and the Office of National Statistics estimate it could affect 10% of those who've had the virus. So how does he plan to avoid an unacceptably high risk of long COVID in young adults and children who are not fully vaccinated? And finally, why is he ending the mandatory wearing of masks in indoor spaces and public transport when they reduce viral spread and cause no economic detriment? Does he not recognise that as vulnerable people can't count on others wearing masks, for them the 19th of July will not be Freedom Day, but the exact opposite?
Thank you, Mr. Speaker. First, I noticed the Honourable Lady, thanks for what she said about the English football team, but she didn't say who she actually supported, so I hope it was actually England. But turning to her questions, on the hospitalisations, she's right to raise this, as other colleagues have, that of course, as cases rise, which sadly they will for the reasons I've set out, hospitalisations will rise too. But again, for a reason set out, number one being the vaccine, that the rate of hospitalisation will be far, far lower than anything we've seen before. And she will also know, given her experience, that also the treatments that are available are a lot better and effective than what we had at the start of this pandemic and during the last wave, which is also helping should people sadly find themselves in hospital. It is something as part of the three tests, test number 3, that we've looked at very carefully. We've looked at the data. Of course, we work very closely with our colleagues on an almost minute-by-minute basis in the NHS to make sure that the increased pressure, and I accept there will be increased pressure, I've been very open about that it will be something that can be met and sustained. And it is important, though, I think, to understand that, because she mentioned the backlogs, that the backlog has built up over the pandemic because people stayed away from the NHS for perfectly understandable reasons. But we do need to start getting back to normal as quickly as we reasonably can, so that we can start looking at more people in the longer term at the NHS and actually improve the backlog more quickly than otherwise. And then on masks, Mr. Speaker, I believe I've answered that question. And the most important thing is that our guidelines are going to be very clear on masks, and they will be published later today as well.